brings you to the hospital today?
You know, I have a history of high blood pressure. And
okay. Well, let's get your blood pressure checked and just see if you have any concerns.
Okay.
Great. All right. I'm just going to write some things down in your file, and I'll come right back and talk to you.
Okay, great. What are my results? Are they okay? Did I pass the test?
Well, it's 140/90.
What does that mean?
That means you have hypertension, and hypertension is caused by high cardiac output. So cardiac output is how much blood your heart pumps per minute. So that's elevated. And your blood vessels, so your arteries and your veins, they're constricted. And usually that is, it could be from diet, could be from smoking. So maybe we'll talk a little bit about your lifestyle.
Okay.
Okay.
Pretty healthy.
All right.
What's the, just so I know, what's the normal blood pressure?
Normal blood pressure is 120/80. So you're about 30 above.
And is that bad? Like, is that really bad?
Yeah, it puts you at risk for coronary artery disease.
Oh, that sounds bad.
Yeah, so a heart attack.
Oh, wow.
Yeah. So this is, it's good you come in.
That's how my mom died.
Sorry to hear that.
Thanks.
But it's not as bleak as you think. You're still young.
Yeah.
So let's just talk about your lifestyle. First of all, do you smoke?
No, never.
Okay. So you don't smoke?
No.
Okay. And how about alcohol? Would you say you drink moderately, heavily?
Nope.
You don't, not even a glass of wine?
Don't like the stuff.
So no alcohol. Well, that's good. How about exercise?
All the time.
And what kind of exercises are you doing?
Yeah, watch this video. It's I watched this video. It's called Zumba.
Zumba?
It's great. It's kind of like that.
Okay.
I was doing that.
Okay. Well, that's good.
Yeah.
But you say you watch the video?
You know.
Woo!
Okay, take it forward.
I'm doing it.
8, 7, 6, 5, 4. Keeping the stomach locked with a bend. That's the way. Keeping it up 9%.
Oh, break the sweat here. I need some hydration.
8, 7, 6, 5, 4.
3, 2, 1.
All right. Well, that's something we could modify. We'll get back to that. I'm just going to continue. So how about your life? Stress. Is there anything in your life that brings you stress?
Not that I can think of.
I'm your father. You should listen to me. What are you doing with your life? Drinking, smoking, partying. Am I ever going to have grandchildren? You know your mother died young. I don't know where you get it from. Jeez. Okay.
Yeah.
And is there anything in your life that you're passionate about that sort of relieves tension?
Well, I used to rap with my friend Freaky C, but I don't really do that anymore.
Well, creative outlet is definitely a good way to reduce stress.
Yeah.
So I would encourage you to get back into rapping.
Okay. I didn't expect to hear that from the nurse.
Oh, well, anything that kind of elevates happiness, it will reduce stress and tension.
Cool.
So that is
sounds good to me.
Yeah, so let's work on that. So at this point, I don't want to get you on medication. I feel like we can bring down your blood pressure with just modifications to your lifestyle.
Okay.
You're saying you don't smoke or drink, so that's good. But how about your food, your nutrition?
Yeah, I eat food. Good food. 1.
Okay, so how about fruits and vegetables? Are you eating?
Sometimes, yeah.
Well, let's increase your fruits and vegetables. So,
Okay.
We also want you to have a lot of fiber and not too much salt.
Oh, okay.
Yeah, so salt.
Yeah, all right.
Your lifestyle, it's indicating that you should not have hypertension, so I'm starting to wonder if possibly your hypertension is due to what we call white coat syndrome.
Oh.
A doctor wears a white coat. I'm not wearing a white coat. But basically, you come into the hospital and you're nervous, so that elevates your blood pressure.
Ah, okay. This makes sense now. That's why.
That could be it, just based on what you're telling me. But I do want you to really eat healthy, exercise at least 20 minutes every day.
Okay.
Okay? And I'll get you to come back in about a month. And if things haven't changed, I'm going to get the doctor to look at your case and possibly get you onto some medication.
Okay, so I have a month then, basically.
Yes, and in that month, I'm going to get you to monitor your own blood pressure. So I'll teach you how to do that before you go.
Okay.
And keep a record of your blood pressure.
Okay.
And, yeah, so thanks for coming in. I think you're on the right track.
Hey Jenna, how's it going? Seems like you're pretty stressed out.
I am stressed out. I went to the doctor, like you told me to, and she took my blood pressure, and she basically told me that I have really high blood pressure, and if I don't get it together, I'm going to have to go on medication or maybe have a heart attack, like my mom did. I don't know. I'm just really stressed about it. And she told me, this is the worst part, she told me I couldn't drink, I couldn't smoke, I don't exercise enough, and like, I don't eat enough healthy food. I don't get it. I don't know. I just feel really discouraged. Like, how am I gonna pull this together? You know, like, I can't do this. I'm supposed to meet her in a month. I just can't.
You sound pretty negative about it. Maybe you should get in touch with your spiritual side.
I don't really have a spiritual side.
You seem pretty interested in like my culture, and we have something called smudging. It's to cleanse yourself of all the negative things, your thoughts, your feelings, and everything. And it's really nice. We have a seashell, which represents water. I use sage to represent earth, and then we light it for fire, and then it makes smoke, and then with that smoke it cleanses your body, and the smoke represents earth. It's really nice.
Wow, that sounds amazing. Well, how do I do this?
I could do it with you.
Really?
Yeah.
Okay. Maybe this can be my beginning to my new me.
Yeah.
Thanks.
So what I'm going to do is I'm going to brush this all over your body. And then at the end, you could put it to your mind.
All right. This time I'm actually going to work out.
Know it like a bubble. Nice. Clouds on the couch.
Just your arm.
Baby, she got that seat now, make a grown man crazy.
If you wanna take it out, add a
grown man crazy. Shawty in the gym, ass amazing. I pull up, I get her, ass easy. She go back, she look back, I'm cheesing. I'm Kodak, my Rolex.
Freaky C.
All right, Jenna.
I need a better rapper name.
High blood pressure is difficult to measure. Ask your professor for a refresher. Fat, salt, sugar is bad. Exercise daily and you'll be glad.
Don't want hypertension?
Learn about prevention.
Pay special
Attention to the convention. 120 over 80, you're doing fine. 140 over 90, lay off the wine.
Okay. Fat.
Salt,
Sugar is bad.
exercise daily, and you'll be glad.
What?
That's
Jenna. Miss Talia, your results are back, and you are 125/83. Good work!
Woo! High blood pressure is difficult to measure. Ask your professor for a refresher. Fat, salt, sugar